And June is Scleroderma Awareness Month, which is an opportunity to help us better understand this rare autoimmune disease. Scleroderma literally means hard skin because the condition can cause thickening and tightening of the skin, as well as serious damage to internal organs. There is no known cause and no cure, and approximately 1 in 2,500 Canadians lives with the disease, which can be life-changing and even life-threatening. Here to tell us more is Jason Doucette, the president of Scleroderma Atlantic, and Andrea Solofsky, a volunteer who was recently diagnosed with scleroderma. Good morning to you both.
Good morning.
Good morning.
So let's begin with you, Jason. For viewers who are not familiar with scleroderma, explain what this is.
Sure. So, like as you mentioned, Crystal, it literally means hard skin. So it can affect you externally, so you can see sort of the tightened mouth perhaps, or you can see tightened digits, your fingers are really tightened up, or it can affect you internally as well, so your internal organs, kidneys, heart, lungs, all of that. So it can be either a visible disease or quite an invisible disease as well.
Okay, well, Andrea, you were recently diagnosed, very recently.
Yeah, just in February.
Oh my goodness.
Semi-diagnosed, I guess, in December was my first appointment that I got in with the rheumatologist. Yeah, and it was one of those things. I just had all of these random symptoms going on. Had never heard of the disease, scleroderma, so just kind of threw all these random symptoms at the rheumatologist, not even knowing if they were related or not.
Yeah.
Turns out all of them actually were symptoms. And she kind of, on the spot, sent me away with some additional blood work tests for scleroderma, and they came back positive in February. And
well, I think this is interesting for our viewers because just even knowing the process, can you tell us some of the symptoms you were having?
Yeah, so it was random things. All the power to my rheumatologist. I kind of told her, like, spicy food is spicier, which is random.
Interesting.
Pain is more painful. But the main thing for me was Raynaud's phenomenon, or
yes.
Raynaud's syndrome it's called, where the blood flow stops in your hands in severe events like colds or stress.
Yeah.
So that's kind of how it all started, and then it turned into like joint pain through the hands. Joint pain, randomly I'd wake up every morning, a different joint would be severely stiff and sore kind of thing. So I knew something was going on and just kind of kept going to the doctors.
Yeah.
And they would do standard blood work and nothing would come back positive. So got into the rheumatologist, threw these random set of symptoms at her, and all the power to her.
You have scleroderma.
Yes,
which is good news. We've determined what you have. But Jason, congratulations. We don't know how you got it, and there's no cure.
Absolutely.
So how do you support people who have scleroderma?
Well, really what we're trying to do is provide that education piece and raising awareness, because we want to raise awareness amongst the medical community so that there can be diagnosis a little bit faster, but also amongst the patient base, because we have patients out there that we know have scleroderma. It happened this past weekend at one of our walks. They were just seeing us walk by and they're like, well, what are you doing here in the park? Well, we're walking for scleroderma. Well, I have scleroderma. So we want to make sure that they know that we're here so we can help support them.
Interesting. Here we have people walking last year. This has been a big success. You raised a lot of money last year. Yeah,
last year through 5 events, we raised over $50,000, and we're well on our way again this year. We've had 4 events so far across Atlantic Canada, the last one happening this weekend here in Bedford.
Tell us more about it.
Yeah, so it's a great event. It's really an opportunity for folks to come out, to connect. Living with scleroderma is not easy, but we really want to do is have June become a month to celebrate. Really, those who are living with scleroderma come together, connect with each other, learn from each other. So there's going to be a walk happening in Dewolf Park in Bedford this weekend, an opportunity to have a barbecue, come out, and just meet and greet some folks.
Well, it certainly would be wonderful to be able to chat with other people who are experiencing scleroderma, especially for you, Andrea, because you're so new in the journey, just to kind of know what to expect. People could let you know how they cope with it. Have you noticed it impacting your life on the day-to-day?
Yeah, there's definitely been some changes to my routine. Excuse me, probably for the better, actually.
Yeah.
Waking up, taking care of myself a lot more. Lots of face lotions and stuff like that, because you do get that skin tightening and the dry skin, and taking care of your skin, your overall health, and a lot more medications that I have to take too. I was never kind of the person that would take medications, and now I've got one of those whole, like, almost advent calendars of what pills to take each day. Big
changes.
Yes.
At least now you know what you are dealing with, and I think that's why Scleroderma Atlantic can help people who are perhaps, like Andrea, newly diagnosed, or even figuring out what's going on.
Absolutely. Like I say, we're really here to try to raise awareness and make sure that those who are living with this disease know that we're here to support them.
Well, I hope there is a cure, and congratulations to you and your team for walking. And that just, again, remind people where the one in Bedford's taking place.
So the one in Bedford will be in Dewolf Park this weekend on Saturday at 11:30 registration.
And anyone can come?
Anyone can come. The more the merrier. Absolutely. Family barbecue, just a great opportunity to walk and show your support.
Okay, wonderful. Thank you both for coming in this morning.
Thank you.
I appreciate it.
Good luck at the walk. We put information about scleroderma on our website. website to make it easy for you to find, and of course information about the events taking place. There are 5 across the region. We'll be right back after this break. Hope to see you then.